Okay students, so now let us start with our next topic, that is space regainers. So what is a space regainer? If a space is progressively lost, then regaining of the space should be considered to avoid further dental harmony. Okay, if space is progressively lost, then regaining a space should be considered to avoid further dental harmony. So the definition of space regainer, it includes: when the space is progressively lost, the therapy should consider to regain the space so that additional disharmonies do not develop. Space regainers are the appliances used to restore space and occlusal harmony and further minimize the complex orthodontic treatments and facilitate permanent tooth eruption. Once more, space regainer are the appliance which restores occlusal harmony, further minimize the complex orthodontic treatment, facilitate permanent tooth eruption. Once again, space regainers are the appliance used to restore space and occlusal harmony, further minimizes the complex orthodontic treatments and facilitate permanent tooth eruption. Okay. So what are the types of space regainer? First we'll cover the removable space regainers. So according to Goodale, he had told several types of removable space regainers, which are free end loop spring space regainer, split block space regainer, fixed loop spring space regainer, slingshot space regainer. Once again, free end loop spring space regainer, split block space regainer, fixed loop spring space regainer, and slingshot space regainer. So what are the parts of a free end loop spring space regainer? It has got a labial arch wire which provides retention, back action loop spring which is made up of 0.025 wire, and acrylic base. So this is my labial arch wire. Okay, the drawing is not that great, but please try to cooperate. This is my labial arch. Okay, it has got a back action spring, and this is my acrylic plate. These are my acrylic plate. So how do we activate it? The free end loop is activated to attain the desired movement. So what are the benefits? That because of the short wire loop, less distortion occurs when the child inserts it. Okay, once again, it has got a labial arch wire for retention, back action loop spring, and an acrylic base. Free end loop is activated to attain the desired movement. Simple. Next is the split block space regainer. It is of dumbbell shape, which is made up of 0.025 wire, which is placed buccolingually. It is placed, and it has got an acrylic block. Which is also placed buccolingually. Activation: the acrylic plate with split disc is activated buccolingually. What is the precaution? The unilateral type, which is used in adults, should not be used in kids because of the risk of swallowing. Okay. Once again, it has got a dumbbell shape which is of 0.025, which is placed buccolingually. It has got a split acrylic, and the split acrylic is activated buccolingually to get the desired movement. Now the next one is the fixed loop spring space regainer. Parts: it includes orthodontic wire, which is embedded in the acrylic, which is brought through the embrasure, and it is bent down to contact the teeth below the contact points. So this is my orthodontic wire. Then it is embedded in the acrylic resin. This full is my acrylic resin. Okay, this full is my acrylic resin. Then it is brought through the embrasure, and it is bent, and it is bent to contact the teeth below the contact points. It can be used as a space maintainer by soldering the activator portion of the spring. So this is my fixed loop. This was my free end. It wasn't embedded in the acrylic plate, but here it is embedded. The spring is embedded. Then last is slingshot space regainer. It has got a wire elastic holder. This is my elastic holder, and then it has got this is my elastic holder, and this is a hook slingshot. What has happened, this force to distalize the tooth, and the procedure by elastic which is stretched on the middle of the lingual and buccal surfaces of the molars to be moved. Okay, you can see these two are my elastics. These are my elastics which are stretched over the buccal and the lingual middle portion, and it is on the tooth which has to be distalized. Then which will cover fixed space regainers. First is the Jaffe's appliance. Jaffe has given in 1963. It helps in minor tooth movement, useful in the presence of ankylosed tooth or early loss of deciduous molar, or in cases of extraction. Again, minor tooth movement, ankylosed tooth, early loss of deciduous molar, and extraction. Action: light spring pressure against the sliding section or arch. Okay, we provide in Jaffe's tubes light spring pressure. Parts: it has got a buccal and lingual arms, it has got a molar band, and it has got a sliding arch. Once again, Jaffe appliance given by Jaffe in 1963. Minor tooth movement in cases of ankylosed tooth or early loss or in extraction. Light pressure, spring pressure is given against the sliding section of or against the arch, and it has got a buccal and lingual arm, it has got molar bands and sliding arch. Next is my Gerber space regainer, also known as Gerber space regainers. It can be fabricated chair side. Parts: it has got a band on the abutment tooth. Mesial to the band surface is my U. This you can see, this is my U loop, which is soldered, and it is placed inside the molar tubes. Here it will be placed inside the molar tubes, and it is contact the tooth mesial to the edentulous space. Then the welded tube in this tube stops are also placed. Then open coil spring is placed between the stops and the ends of the U tube. Then measure the assembly desired portion and the distance between the mesial contact to the entry of the wire, plus 1 to 2 mm for the activation of spring, which add amount to be regained. Okay, once again, Gerber space regainer can be fabricated chair side. It has got band on the abutment tooth. It has U-shaped assemblies there. It has got tube stops are there. And the spring is attached. And then the desired appliance is placed inside the mouth. Measure it, and then add 1 to 2 mm for the activation of the spring. Okay. Now next is the Holt's lingual arch. We have studied in our space maintainer about the lingual arch space maintainer. Its modification is when the Wilson loops are added. It is known as Holt's lingual arch. It was given by Hitchcock in the 1974. You remember Hitchcock has given classifications of space maintainer. So that Hitchcock only has in 1974 Holt's lingual arch. Indications: when in this the permanent molars should be mesially drifted, but my premolar should be uprighted. In such cases we can use, and sufficient space should be present for the eruption of second premolar eruption. It has got a lingual arch for anchorage. It has, these are the my Wilson loops are there, and active side, and it is adjusted periodically once a month. Okay, next is the lip bumper. It is used for mandibular arch. If used for maxillary arch, it is known as Denholtz appliance. It has got molar bands, it has got molar tubes, it has got labial arch wire, it has got acrylic button on the labial vestibule. Once again, molar bands, molar tube, labial arch wire, acrylic button on the labial vestibule. Activation: it from the force of the lips is transferred to the buccal aspect of the first molar, and then it will help in distalization. It is indicated in early primary dentition, uprighting mesially tipped molars. Okay, I hope there is no confusion. Next is our King's appliance, which is given by King in the year 1997. It is used for both maxilla and mandible. Fixed type of lingual arch. We are of course these all are fixed appliances. Then bands on the primary first molar. You will band it on the primary first molar, primary first molar on the treatment side, and on the permanent molar banding is done on the opposite side. Then the edgewise bracket, here edgewise bracket is welded on the buccal surface of the primary molars, and then band is angulated with the tube. Okay, angulate the band along the tube, and then cement and it is cemented over the malpositioned molar. Then a straight wire with open coil is a straight wire with open coil is put into the buccal tube, and then it is ligated on the wire. So this is my tooth which is to be distalized. This is my first this is my first molar. Here you will edgewise bracket will be added, then you will add edgewise bracket, and then this band will be angulated with the buccal tube, and then it is cemented on the malpositioned molar, and then a straight wire will be inserted in which open coil will be there. This straight wire will contain open coil, and this open coil when it is placed on the buccal tube and it is ligated on the wire, it will give a distal pressure. Once again, it is King's appliance. It is little you have to understand. Just once again I am repeating it. I know that it might have been, you might be confused, so I will just clear this up. King's appliance was given in 1997 by King, used for both maxilla and mandible. It has got a fixed lingual arch. This is my fixed lingual arch. It banding is done on the first primary molar on the treatment side and the permanent molar on the other side. Then the edgewise bracket is placed on the primary molar, on the buccal surface of primary molar. Then a band angulated buccal tube is placed over the band, and then a straight wire with open coil spring is placed here, and then this open coil spring is cemented over the malpositioned tooth, and then and it is ligated on the bracket, and this will here is the bracket, here is the tube, here is the straight wire with the open coil, and then it will give a distal force. Okay, now next is the anterior space regainer. It has got two labial tubes are there, which is made up of stainless steel mesh spots. It is welded and trimmed. Tubes are welded and it is trimmed. Then one tube is placed on the left central incisor, one on the right lateral incisor. Okay, then it is etched. The labial tubes are bonded over the left central incisor and the right lateral incisor. Okay, now a wire which is made up of 0.014 gauge is placed over the labial tube of central incisor, and then a distal bent is given. 2 mm from the distal end of that labial tube, and then after 3 weeks activation will be done. Now wire will be replaced of 0.016 gauge. 3 weeks it will be made up of 0.018 gauge, and lastly it will be 0.018 into 0.025 gauge. Okay, so for anterior space regainers, 2 labial tubes we are taking. One we are placing on left central incisor, one on the right lateral incisor. Then we keep on changing the wire. Firstly we use 0.014 ka gauge wire, then 0.016 gauge wire, 0.018 gauge wire, and lastly 0.018 into 0.025 gauge wire, and this will help in anterior space regaining. Last fixed space regainer is the space regainer cum space maintainer. Okay, now here what do? We do banding, then we take an impression, then we use a canine retractor or a U-loop of 21 gauge wire, and it is cemented, which activation is done by opening the U-loop or the coil spring or of the retractor. And space regainer, when space is present, mesial to the, okay, when do we use this? When the space is present mesial to the erupted tooth. So this here this is the canine. Here this tooth has been come here, so we will use a canine retractor here, and this will push. Okay, here one sec, we will use a canine retractor or an open U-loop we can use, and then when we activate it, it will provide a distal pressure. Okay, lastly, now we'll study about the recent advancements. So first type is the unilateral spring space regainer. It has got stainless steel band which is placed around to anchor the tooth. It has got a lingual sheath which is attached to the band. It extends along the palatal area. It provides rigidity. It has got a band. It has got a lingual sheath. It has got a active arm which is the bent wire component connected to the band, extends distally to active force to move the adjacent tooth mesially. Spring is placed on active arm, generates force which is required to push the tooth gradually. You can see this is the appliance. So it has got banding is done for anchorage. Active force, this will apply active force here on the active arm. Controlled movement by continuous force application. It helps in stimulation of bone remodeling. A Nance button, here you will see a Nance button is placed here, which provides anchorage and prevents unwanted movement of the molar. Okay, now next is our lingual arch, crossbow and double banded space regainer. First first recent advancement was a unilateral spring space regainer. Other one is lingual arch, crossbow and double banded space regainer. It prevents the mesial drifting. Parts, it has got a molar tube. Here you can see it has got a molar tube which is welded on the molar bands. It has got a curved stainless steel wire is there. Then the free end passes through the molar tubes and a open coil night eye spring is used. Lingual arch crossbow we are using here, which engages the mesiocervical margins of the first premolars. Now the space maintenance. Once the required space is regained, you can just the spring is deactivated and by adding the self cure acrylic. Okay, now it will act as a space maintainer. So it is known as lingual arch crossbow, double banded space regainer. Lingual arch crossbow double banded space regainer. It has got a molar tube. It has got a curved stainless steel wire. It has got a lingual arch crossbow and space maintainers. When you just deactivate the spring and add self cure acrylic. When do we use this lingual arch crossbow and double banded space regainer? To give a space closure between the primary canine and missing second premolar. Okay, I hope it is clear. Once again we'll just see the names. Removable space regainer, free end loop spring space regainer, split block space regainer, fixed loop spring space regainer, slingshot space regainer. Fixed space regainers are the Jaffe's appliance, Gerber appliance, Holt's lingual arch, lip bumper, King appliance, anterior space regainer and space regainer cum space maintainer. Recent advancements includes the unilateral spring space regainer and the lingual arch crossbow double bonded space regainer. This I have taken from the article from International Journal of Applied Dental Sciences 2020. Authors were Ankita Uppal and Dr. Rajendra Singh. Okay, you can quote this article. International Journal of Applied Dental Science 2020. Authors are Ankita Uppal and Dr. Rajendra Singh, and they have concluded that management of space problem in mixed dentition plays an important role in pediatric dental practice, and understanding on the development of the primary and the mixed dentition helps in deciding how to intercept the dentition malocclusion due to premature loss of deciduous teeth. Proximal stripping and serial extraction are irreversible and invasive techniques for treating malocclusion, while space regainers with removable and fixed space regainer appliance are non-invasive techniques and helps in interception of malocclusion. I hope this was all clear. If you have any doubt, please post it in the comment section, or if you want me to add on any details about any of the appliances, or if you have any confusion, please kindly let me know. I'll be happy to help. I hope it was informative. Thank you.